We are on live, na, Arvind?
Yes.
Yes. Bhalchandra sir, with your permission, I am going to start the program. So, good evening, one and all. Welcome you to this academic extravaganza from the Pune Psychiatric Society. And it is going to the second chapter, as most of you have attended the first program on Freud. And this is going to be the second chapter on the things, and a series of academic programs are going to come. And I, on behalf of this entire academic segment, fraternity, I am welcoming you everybody in this great evening where we can exchange our thoughts with the masters in the psychiatric segments. My name is Anirban Mitra. I am taking care about the marketing aspects of Center Pharmaceuticals. I am been proud to be associated with these stalwarts of psychiatry fraternity. So once again, I am welcoming everybody and saying good evening. And as I have not met many of them personally, so we once again wish a very happy new year to all of you. And our wish is always a different and involving a health aspects that we wish that everybody in this year will be free from this PPE kit and this mask. Let us unmask to once again coming back to the normalcy. So with that good wish itself, I would like to introduce the things, the topics, as you have seen, and lots of people have, doctors fraternity has been involved. That Sathi Hath Barana. Sathi Hath Barana means always hand in hand, and the topics will be taken care by lots of important and stalwarts of psychiatry. I would rather say starting up of this program that in this COVID situation, what we have faced in the last year, even if the latest things, psychiatry manifestation has been increased multifold. That is also an old news. What is the new in the psychiatry right now? That is the, even after coming of the all the injections and everything, COVID shield and everything has been come into the world. There is a lethargy from the people front that I will not take it. So this is another kind of psychiatric manifestation and a taboo we have to coming out. So many of the things in the world now suffering that has not been defined as a psychiatric manifestation. So psychiatry has been evolving every day. So we have to learn what has been the newest things in the psychiatry, as well as keeping in the mind the backbone of the psychiatry. So with that things, I would like to introduce the moderator of this session. First, I would like to introduce Bhalchandra Kalmegh sir, requesting Shruti to project the slide. Coming out, Shruti. You make it off and once again start. Yes. Yeah. Now make it full screen. So let me have the privilege to introduce our coordinator and moderator, Dr. Bhalchandra Kalmegh sir. The slide is, Shruti, please give. Or else, meanwhile, I'll just introduce her. Sir is a practicing psychiatrist, yes, and Sir is MBBS, MD, DPM, and a medical director and chief psychiatrist from Pune. And Sir is having the associated in the Nirman Psychiatric Nursing Rehabilitation and De-Addiction Center in Pune. Sir is ex-honorary treasurer and secretary of IPS of Pune Branch. Okay. Sir has worked as a junior resident in Masina Hospital, Mumbai, in Department of Psychiatry in 2005 and 7. Then worked as a registrar in KEM Hospital, Mumbai, and advisor for Mental Health Awareness Forum. Sir has paper publication in Annual National Conference of Indian Psychiatric Society in ANSIPS 2014 at Kochi. Sir having 2 international paper publications on major depressive disorder in Hindawil and Asian Journal of Psychiatry. Chief editor for book MHCA in 2017, where the book was on Together We Can. Sir is the member of Indian Psychiatric Society, Pune Psychiatric Society, All India Association of Private Psychiatry, American Association of Psychiatry, and many more organizations. Sir is an active participating member in the local, state, zonal level CMEs and conferences and an organizing committee member. So you can see as a moderator, we have got the best person among us, Dr. Bhalchandra Kalmegh, sir. Welcome you, sir. And next, I will have the privilege to introduce another of our coordinator moderator for the session, Dr. Yogesh Pokhale, sir. Shruti, just next slide. So, Pokhale sir is MBBS DPM and the member of the Indian Psychiatric Society. Sir has done his MBBS from D.Y. Patel Medical College and Hospital and then diploma in psychiatry from NDMVP Samaj Medical College, Nasik. Sir is practicing at Yashwantrao Chavan Memorial Hospital and consultant psychiatrist at Manush Sevaran Dedication and Psychiatric Rehabilitation Center, Balewari, and consultant psychiatrist at Accord Sant Daneshwar Hospital. And Sir is also privately practicing at Bosari and Mosi and attached to various hospitals and in Pune and this region. So welcome you, Yogesh Pokhale, sir. So with this introduction, I will hand over the introduction sessions to Bhalchandra Kalmegh, sir. Sir, over to you.
Thank you, Anirban. I welcome you all to the Sathi Badhana, a monthly webinar series on basics of psychiatry, which will be held on every fourth Friday, and it is organized by PPA, that is Pune Psychiatrist Association, and IPS, that is Indian Psychiatric Society Pune Branch. At the outset, I must accept that I am overwhelmed with the response that we got for this program. We have already crossed 300 registrations, which include general practitioners, psychologists, social workers, UG students, and nursing students. So we have mixed population and audience with the same aim of being mental health profession. Dear friends, today we are starting the journey to learn about the psychiatry, which is a branch of human medicine which don't have counterpart in the veterinary science. And this will be 1 year journey filled with lots of learning and fun. I am your program coordinator and moderator, and I will be there with you throughout the year. To make this learning experience fruitful, there are some instructions as follows. Every session will be having 2 lectures on a particular topic by expert speaker. We know that all points on a particular topic cannot be covered in limited time. So please read standard textbook on a particular topic, watch movies related to it, and discuss the topic with your peers. Take active participation in the session by asking questions. We have kept prizes for the best question asked in every session. Also, we have kept self-assessment MCQ test after each session. I request you all to save my mobile number 8888 I repeat 8888 in your WhatsApp contact in order to receive monthly link of the session PPTs and MCQ test. Also, give your valuable feedback so that we can improve session by session. Lastly, like, subscribe and share our Facebook page and YouTube channel, that is PPA IPS Pune Branch. So let's start with the opening session of the webinar series with first session, that is no health without mental health. And the speaker for this session is Dr. Madhumita Bahaley. Would you please share the slide? Dr. Madhumita Bahaley is MBBS DPM from BJ Medical College, Pune. She is Class 1 Psychiatrist at District Hospital, Pune, and President of Pune Psychiatrist Association. She has a vast experience of 33 years in Maharashtra State Health Department and Regional Mental Hospital, Pune. She has taken various programs. One of them is Mann, which was carried out for the COVID patient and healthcare workers. She has also played a pivotal role in Prerna project, Maharashtra, that aim at restoring mental health and reducing suicide by the farmers. Another project she took was Manoj, which was dedicated to the people affected in disastrous flood in Kolhapur and Sangli district of the Maharashtra. In recent COVID pandemic, she worked for more than 36,000 migrant workers and laborers at 280 construction sites in whole of the Pune district. She has conducted many mental health awareness and stress management programs, and she has conducted many training programs for the medical hospitals and primary healthcare centers. Her personal hobbies are listening to the old music. In our PPA, she is the motherly figure loved by all. So, over to you, madam, for the first session.
Thank you very much, Bhalchandra, for that nice introduction. Good evening, everybody. Sagyana Namaskar. It is so heartening and so encouraging that we have received so many registrations for the first webinar, this series, Sathi Badhana, by the Pune Psychiatric Association and the IPS Pune Branch, is to establish a communication between general practitioners, mental health professionals, and mental health experts. In this series, we are going to know about mental health, about mental illness, and we are going to inspire each other to start mental health awareness in the community. We have always thought, as members of PPA and IPS, that we should be together. We should bring all together. We all need to work together for the mental health well-being of all the people around us in general, and particularly the mental health well-being of our patients in particular. So there is definitely a need for all of us to come together. Shruti, will you please start the slide share? Friends, we always come together whenever there is a calamity in the of a physical illness. We have fought together for the eradication of polio, and we are fighting against TB. And recently, we are fighting against the COVID pandemic. Each one of us have done their bits, given their selfless services, and we have tried to make the community healthier. Mental health issues are becoming a universal concern now. It is time that we understand, speak, and deal more openly on mental health issues, which are increasing like never before in the whole world. So we all of us need to come together and start spreading awareness. So we must understand firstly what is mental health. Second slide, please. So as per the WHO, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution towards the society. So there is a steady sense of self, belief, and confidence in the qualities and abilities of our own, ability to control, guide our own thoughts, speech, and behavior for maximum gain to self and to the society. Now, anything that disrupts any of this component of mental health will lead to a mental health disorder, which may be major or a minor one. So, what happens if a person falls into mental health disorder? Why do we need to look into mental health disorders on a larger scale? Let us see. Next slide. The mental health disorders create a huge impact. Firstly, it has an astounding effect on the individual's physical, social, and emotional health. and negatively it affects his productivity and financial capacity. Secondly, relationships in the family are impaired. Interpersonal issues lead to harmful consequences, and there is a constant stressor for each member of the family. For the society and consequently the nation, there is a huge loss in economy because due to mental health disorder, people who are healthy and productive, they now become incapable of contributing to the finances and growth of the country. And above that, there is a burden on the country about the safety, treatment, and rehabilitation issues that may arise due to the mental health disorder. So, seeing the impact on individual, family, and society level, we know, next slide, that we have to make mental health a priority. No nation can progress until and unless all its people are in good mental health and there is mental health well-being in the society. You and me, we all have to see that mental health disorders in our country, in our society, do not increase in number and in severity. Next slide. We know very well the definition of health of the WHO, which states that health is not merely the absence of a disease or infirmity, but it is a state of complete physical, mental, and social well-being. The emotional and spiritual well-being aspects were added later on by the WHO. But the three main aspects are physical, mental, and social. If a person wants to be happy, next slide. If a person has to be completely healthy, he has to be able to enjoy all these aspects of health. And only a completely healthy person is capable of handling and enjoying the possibilities that life has to offer, and then becomes happy and satisfied in his journey. So, is there a relationship between these aspects of health? Next slide. Is mental health so important that it affects the other aspects of health also? Yes. Here we see that this is a physically fit person, but he can maintain his physical well-being only if he is also mentally fit to do all those things that are necessary to maintain his physical health. If a physically healthy person becomes sick or impaired in the mind, his mental health gets impaired. What happens is he loses his motivation to maintain his physical health, and slowly sleep disturbances, anxiety, and other things may creep in, and his body may become vulnerable to certain diseases. So for good physical health, we know now that good mental health is definitely necessary. So what happens next? If in a healthy person, a physical health stressor comes up, something like a major disease, HIV, cancer, or accident, deformities, anything, life-threatening conditions, there can be two possibilities. If the mental health of such a person is intact, then his right thinking procedures will lead to proper and adequate coping, and the person will perceive the situation in the right way. He will adopt the right behaviors, he will develop the right attitude, and he will come out of the situation or accept the limitations of the situation in the best manner. But if his mental health is not up to the mark and an external or an internal assault by accident or disease takes place, he is engulfed by numerous thoughts, majority negative ones, which weaken his mental abilities, cause confusion, a state of poor confidence will develop, helplessness, hopelessness might come in, and he may become a victim of anxiety and depression. This will cause an negative effect on his immune system and further deterioration of his physical health will take place. Next slide. I have seen many patients of MDR TB who become so anxious, so worried, so depressed that they leave their treatments halfway and then they fall victim to because of the worsening of the disease. So if we want to get out of a health infirmity, our good mental health is also very, very necessary. So here we see that healthy body and healthy mind will definitely give you excellent health. But an unhealthy body, which carries a healthy mind, the mind will motivate the body to do the right things, and good health can still be achieved and restored. A healthy mind with an healthy body, but an unhealthy mind, that may lead the person to a sickness. And of course, unhealthy body and an unhealthy mind too will definitely cause ill health and deterioration in all aspects of the health. Next slide. So, for good and excellent health, what is most necessary is good mind and good mental health. So, the next aspect of health, that is social well-being. Social well-being is when a person is able to establish good relationships in society, have a healthy exchange of thoughts, words, and actions with people around him, and get optimal benefit for the development of his own personality. But when will this happen? This will happen only if he is emotionally in a wellness state. If the mind is not in a state of well-being, this person may become anxious, fearful, feel low. He may become aloof from his friends. He does not open to ideas and good behaviors. He forms a shell of his own, does not reach out to others, nor gain from others, and thus, because of his emotional state or mental state, his social life and social well-being is destroyed. Next. So, the social well-being cannot be achieved. Next slide. Social well-being cannot be achieved if a person is not mentally healthy. Social well-being can be achieved only if the mental health is in person's mind is in the right frame. This makes the picture very clear that mental health is most essential pillar for maintenance of good physical and good social health of a person. And there is no total health without mental health. Next slide. So this confirms that there is no health without mental health. Mental health is very, very important, and mental health is everyone's business. Renowned psychiatrist. Now, friends, why is mental health everybody's business? We are living in a world of machines. Next slide. The advanced technology is surrounding us all. We have forgotten to make rational use of this technology, and we are driven into this virtual world without and have little control over ourselves. This going into the virtual world has alienated persons from actual human society. True relationships have taken a setback, and the virtual world is seeming real. There is no time for self, no time for close people, no concern for self and the family. The person living in his own world becomes uh, so alienated from everybody and so aloof from the daily routine of his life that if something comes up, if a real challenge in life comes up, he feels incapable of handling it. Next slide. In addition to this, technology is actually a boon, but we are converting it into a bane. We have to limit its use, otherwise, our mental abilities are definitely going to decrease. In addition to this, of course, there is there there are fads. Fads meaning fast pace of life, achievement hunger, demands of life, and the single family status. In the fast pace of life, a person just keeps running about to achieve all things. He has no time to unwind. To fulfill his achievement hunger, he wants everything too early in life. May it be material possessions like cars and houses, or may it be promotion, prestige, or lots of money, but he is just wants it all in very less time. Then the demands at workplace to fulfill the targets, the demands at home to maintain a proper lifestyle, the demands of society to maintain a good standard image. All this is really causing a lot of stress on a person today and making him vulnerable for mental health disorders. Also, the single family status, where we have nobody to support us physically, emotionally, or financially, is also a major contribution towards all this. And anxiety, worries, depressed moods, hopelessness, fears, all are now becoming a part and parcel of our lives. And friends, we are almost facing a pandemic of mental illnesses. It is hard to believe. But let us see the next slide. Next slide, please. This slide, the National Mental Health Survey, shows us that at least 150 million, that is a good 15 crore people in India, are suffering from mental illnesses and are in need of active medical intervention. More than 10% of the population is showing mental morbidity. 22% are suffering from substance abuse disorders. Almost 3% have major depressive disorders, and 4% have stress-related anxiety disorders. Figures of anxiety, depression may actually be much more. The current COVID pandemic has made matters much more worse in relation to mental health. And we are all expecting a tsunami of mental disorders in the coming years. We have read that India has been declared the most depressed country in the world. In spite of all this, only 20% of these people come forward for treatment. That means 70 to 80% of the people don't reach any mental health professional for either counseling or treatment. So where do these people go? We lose these 70 to 80% of people to chronicity of disease. They become invalids. Their infirmity separates them from family and society, and we lose these people to suicides. Friends, the rate of suicides in India is very, very alarming. There are more than 1 lakh suicides which take place in our country every year. And the most painful part of this is that these suicides are in the age group of 15 to 29 years. So major youth force of the country is lost, and along that is lost major resource of the country. This is a very painful situation. We all have to come together to change this situation. Why does this happen? This happens, people commit suicides, people go into chronic illnesses because people don't talk. People don't speak about their mental disturbances. People don't seek help and they don't come forward for treatment. So, why don't they come forward for treatment? There's lack of awareness, lack of education, there's inappropriate thinking, attitude, and perception of self. There is, of course, lack of mental health facility, and the perception, the negative perception of the society, that is the stigma, prevents many people to come forward for treatment. This picture needs to be changed. Next slide. What can we do? What can we do? Let us know mental health. Through this series, we are going to know mental health. Let us understand mental illnesses. Let us spread awareness in all. Let us work together for all. And first of all, let us talk. We must talk more openly. We must talk more often about mental health issues, mental health disturbances, mental illnesses. We must encourage people to seek help. We have to educate them that mental illness is like any other physical illness and can be treated very effectively. People will keep suffering, bearing losses, feel dejected, become suicidal, but are reluctant to come to a mental health professional because of the stigma that is associated with it. So, what should you and me do? Next slide. Friends, we have to tell them that mental illness is nothing to be ashamed of. Mental illness is not a weakness of the mind. You need not feel ashamed, guilty, or inferior if you have any mental health disturbance. Mental illness can be treated successfully. You can regain your job, status, position. You can become independent. And above all, you can enjoy life like every other person. If we keep educating people on all these aspects and speak more openly, if the medical fraternity, all people who work in the health sector speak more openly about mental health issues, the stigma which surrounds mental illness will slowly reduce. Next slide. The dictum of early diagnosis, early treatment, and early recovery stands true for mental illness also. So we have to detect early. We have to send people for early treatment. If early detection is not made, early referrals are not done, treatment is delayed, and disease gets progressed. And then it may take longer time to respond to treatment. With our support, compassion, and guidance, and the treatment that we will give, a person with mental illness can reintegrate into the society fast. His quality of life will increase, his family life will be restored, his functioning and earning will be regained, and because of all this, a great loss to the nation is also prevented. We all know of we may have heard of a very famous personality who is a very successful businessman who stated in his own biography that he was very depressed, almost on the verge of committing suicide. But he took help, took treatment, came out of depression, and today this person runs a successfully a chain of hotels all across the country. We must give such examples to our patients and motivate them to seek treatment. Next slide. Friends, it is very, very important that we all speak on mental health. Next slide, Shruti, please. आपण इट्स व्हेरी इम्पॉर्टंट टू स्पीक. आपण जितकं मानसिक आरोग्य, मानसिक आजार याबद्दल बोलू, सांगू, लोकांना शिक्षित करू, तितक्या लवकर या आजाराबद्दल समाजात असलेले गैरसमज दूर होणार आहेत. सगळेच जर याबद्दल समजून घेऊन बोलू लागले तर मानसिक आजारांबद्दलची जी संकुचित मनोवृत्ती आणि विचार पद्धती आहे ती निश्चित बदलेल. लोक मानसिक आजाराचा स्वीकार करतील आणि तेव्हाच या आजारांबद्दलचा स्टिग्मा किंवा कलंकतेची भावना ही दूर होईल. We must all bring mental health in the sunlight. Next slide. We must see at mental illness in the right way. We just cannot tell or assure anybody that though you have a mental illness, you will just get over it. Friends, no one can just get over it. Mental illnesses have to be treated. This is a very, very important point. So where do we start now? Next slide. आता सुरुवात कुठून करायची? Now, having understood the importance of mental health, mental well-being, early detection and treatment, the need for education and awareness, the need to remove stigma, there is only one request to you all. Start where you are, use what you have, and do what you can. सुरुवात बोलून करायची आहे, समजून घ्यायचं आहे, आधार द्यायचा आहे, मार्गदर्शन करायचं आहे, एक आयुष्य सुरळीत करायचं आहे. Friends, we all have to work together towards building a mentally healthy community. आणि म्हणूनच ही सिरीज PPA ची साथी हात बढाना. थँक्यू.
थँक्यू मॅडम. तुम्ही फारच चांगल्या रीतीने सांगितलं की there is no health without mental health, because mind is there in the every field of medicine. कुठली पण फील्ड असू द्या, फिजिशियन असू द्या, सर्जरी असू द्या, गायनेकॉलॉजी असू द्या, mind is everywhere in every branch of the medicine. Thank you madam very much for the opening session. Now we will move to the next lecture of this session, that is overview of the psychiatric disorder, and the speaker for this session is Dr. Ivan Netto. He is consultant psychiatrist, MBBS MD psychiatry, and at present practicing at Parmar Plaza Clinic. He is presently associate professor of BJ Medical College, Sasun General Hospital, and MIMA, that is Maharashtra Institute for Mental Health, Pune. He has experience of more than 18 years in teaching, both undergraduate student and postgraduate student. He has experience in forensic psychiatry at Erwara Jail, Sasun Hospital, and Regional Mental Hospital, Pune. At present, he is field editor for the Indian Psychiatric Society, having paper in many national and international journals, and he has citation in the prestigious publication that is mostly prescribing guideline in the psychiatry. Currently, he is chairperson of the Forensic Psychiatry and Law Specialty Indian Psychiatric Society. Participated in the Delphi study for the validation of the ICF course set for schizophrenia by Professor Joana Gomez Benito, University of Barcelona, Spain. He had received training at Alcohol Drug Addiction and AIDS Center, Rome, Italy. He has conducted workshops in psychiatry at Kabul, Afghanistan, and Disaster Management Program at Mahad, Maharashtra. He has delivered presentation at various occasions and have his own blog. Over to you, sir.
Yes. So may I share my screen, please? Yeah.
Yes, sir, you can.
Yeah. So can you see my screen, please?
Yes, sir, yes.
Yes. Can you hear me? Yes.
Yes, audible, clearly audible, sir.
Yeah. So welcome to my presentation on psychiatric disorders and overview. An overview means a short summary. And this talk is specially targeted for non-psychiatrists like general practitioners, psychologists, psychiatric social workers, nurses, undergraduates, and people from NGOs, and those interested in working in the field of mental health. The contents of my presentation, I'll start with biopsychosocial model, then about the problems of mental disorders in India, then the problems of mental health manpower in India, the solutions to the problems of mental health in India, and finally, the role of general practitioners and mental health professionals. So first I begin with the biopsychosocial model. It has already been taken up by Dr. Bahaley in her talk very well. Health is not just an absence of disease, but a state of physical, psychological, and social well-being. So health is not, psychiatry or mental health is not just another subject, it's a dimension, a different dimension of life. As Dr. Bale has already spoken and made it very clear, no health without mental health. This was the slogan of 2005. Now, when we turn to global mental health, we find that psychiatric disorders contribute to 4 of the 10 leading causes of disability. 1 in 4 families suffering the burden of psychiatric disorder. Depression, anxiety, and alcohol use were the commonest disorders in a primary care setting, contributing to nearly 20% cases of psychiatric disorder. Unipolar depression is known to be the 4th leading cause of the global DALYs lost in all ages and both sexes for the year 1998. Now, what is DALYs? DALYs is disability adjusted life years. Traditionally, health liabilities were expressed using one measure, expected on an average number of years of life lost. This measure did not take the impact of disability into account, which can be expressed by years lived with disability. So DALYs is becoming increasingly common in the field of public health and health impact assessment. Mortality and morbidity are combined into a single common metric. So what is DALYs? It is a measure of overall disease burden expressed as the cumulative number of years lost due to ill health, disability, or early death. So it is equal to years lived with disability plus the years of life lost. Why is DALYs important? Because 5 of the leading causes of disability were psychiatric conditions. Psychiatric and neurological conditions account for 28% of all years lived with disability, but only 1/4% of all deaths and 1% of all years of life lost. Thus, psychiatric disorders, which traditionally were not regarded as a major epidemiological problem, are now showing to have a huge impact on populations. So DALI is the global scenario. Neuropsychiatric conditions, the total years lived with disability is 23.7%. The burden is 40% if the most productive age group, that is 15 to 44 years, is considered. The poor, the homeless, the unemployed, and persons with low education are at a high risk. So when the DALIs was contracted for India, in the year 2000, the DALIs lost was 12%. In the year 2020, it increased to 15%. Now coming to the types of psychiatric disorders. So we have the psychotic disorders. An example would be schizophrenia. We have the mood disorders. An example would be bipolar disorders. We have the substance use disorders. An example would be alcohol use disorder. Then we have personality disorders like antisocial personality disorder. We have the organic brain syndromes, and we are all familiar with dementia of old age. And then we have intellectual disability, which is also known as mental retardation in ICD classification. And then we have the various psychosexual disorders. An example would be gender identity disorder, sometimes called also transsexualism. We also have child and adolescent psychiatric disorders, which are mainly nowadays managed by child psychiatrists. An example would be attention deficit hyperactive disorder. Now, we are using mostly the ICD-10, International Classification of Diseases, but there is also the DSM-5 which has come out, which is the American Classification of Diseases. Now, it's very important to understand the difference between psychotic disorders and neurotic disorders, because the approach to these groups of psychiatric disorders are a little different. As I told you, an example would be schizophrenia. In the psychotic disorders, it's usually due to a biological cause like neurochemical imbalance, and the patient loses touch with reality. He becomes insane, and there are manifested by delusions, false beliefs, unshakable, hallucinations, hearing voices when not present, and the insight and judgment is lacking. The person, we have to decide for them. And you may have seen psychiatric patients sometimes who are showing personality deterioration, not had a bath for days, not comb their hair. And then the treatment is mainly pharmacotherapy. Rarely some patients would require electroconvulsive therapy. Psychotherapy has mainly like a supportive role. Many psychotic disorder patients are unwilling to come for treatment, so they have to be brought through a court order or by police or whatever. Now, this is in contrast to neurotic disorders. An example would be anxiety disorder. Here, the cause is mainly environmental personality issues. There are no delusions, hallucinations, the inside judgment is preserved, no personality deterioration as such. Reality testing is there. The patient mainly requires psychotherapeutic intervention, and the patient voluntarily comes for treatment. Then we have another group, the organic brain syndromes. An example would be dementia. In this condition, there is structural damage to the brain, and this is manifested by memory, intelligence, and orientation getting impaired. And if there are hallucinations, they are mainly visual hallucinations. If you do a neurological examination of the patient, you will find some neurological deformity, handicap. Whereas this is not so in the psychiatric disorders where memory, intelligence, orientation is normal. There may be hallucinations, but mainly auditory ones. And if you do a physical checkup, the patient will be normal. Then we have another big group of disorders, the mood disorders. Here the mood is affected and the patient may go through highs, they get elated, they become excited, hyperactivity increases, there is a decreased needs for sleep, or they may go through a bipolar depression where they are depressed, sad, their psychomotor activity decreases, and some of them even become suicidal. They want to die. A very important thing is to differentiate normal mood, grief, which is a normal condition. Normal mood is, I hear a sad thing, I failed an exam. Yes, I'll feel sad. Most people, they'll feel sad for a little while and then they'll come out of it. Suppose someone in my family dies, I may cry, but I'm not yet depressed. I may be going through what we call as a grief reaction. Here, this person, if he requires grief counseling or whatever, within a 6-month period, he usually comes out of it. But what is pathological or what marks illness is neurotic disorders, neurotic depression and psychotic depression. In neurotic depression, the person feels depressed all the while. It's pervasive. His appetite, his distinct decreases. He feels sad all the while. Psychotic disorder, depression is where the person develops hallucinations, where there are voices which may tell him, you're a beggar, you're a sinner, you're a bad person. And so you can get, these are pathological which require treatment. Then we come to a big group of disorders called the psychosexual disorders, which broadly speaking are mainly of 3 types: the psychosexual dysfunctions, then we have the paraphilias, previously they were called perversions, and the gender identity disorders. An example of the first would be premature ejaculation, where a person while having sexual relations he ejaculates too fast. And here we have gender identity disorders where the person wants to change his sex. So here in the sexual dysfunctions, the cause is superficial. The occurrence is common and the treatment is short-term and the results of treatment are good. And therefore, general practitioners, psychologists, they can help in a big way because they can look and treat such type of patients. Whereas, on the other hand, we get the more complicated gender identity disorders. Here, the cause is deep-seated, the occurrence is rare or not so common, the treatment is long-term, and the results of treatment are not so good. Now, we have the epidemiological classification of psychiatric disorders. And they divide the mental disorders into visible mental health problems where the illness comes as a disorder, disease, syndrome level. It's easy to recognize, define, diagnose, and treat. Examples of the major psychiatric disorders are schizophrenia, bipolar disorder, psychotic depression. And the minor disorders, sometimes called, mostly in the mental health survey has been called common mental health disorders, are simple depression, phobias, adjustment problems. But what we sort of neglect in a big way is the invisible mental health problems which do not attain the disorder, disease, syndromal level. Hence, difficult to recognize, define, diagnose, and treat, like domestic violence, child sexual abuse, divorce, marital discord. So, this is the National Mental Health Survey of India 2015-16. It was a landmark survey telling us about the prevalence, pattern, and outcome of psychiatric disorders. This is a government project and it was implemented by the NIMANS, National Institute of Mental Health and Neurosciences, Bangalore. 39,532 individuals across 720 clusters from 80 talukas, 43 districts, and of 12 states. The psychiatric morbidity was found to be 13.7, 10.6 for current morbidity, and severe mental disorders 0.8%. As I told you, we have the common mental health disorders, which represent a group of disorders highly common. Many times they are misdiagnosed as physical illness, and they are going mainly to the physicians and general practitioners. And if not detected early, they lead to long-term disability. Whereas the severe mental disorders cause great morbidity and require intensive and prolonged treatment. Example, schizophrenia, and bipolar depression. So if we look at the National Mental Health Survey, the prevalence of severe mental disorders in 18 was, you can see here, the weightage percentage, most was for substance use disorders, that is alcohol and tobacco. And then the neurotic disorders, depression, and the severe or the serious or the mental disorders are there, but much less than this. So about 130 crore people are affected with mental illness. Psychiatric morbidity 10% or 13 crores, and severe mental disorders about 0.8, that is 1 crore of people. Isn't it alarming? Now, very important is this terminology called treatment gap, which is the percentage of people with mental illness not on treatment. So treatment gap for mental disorders in India ranges 7 to 80%. Isn't it shocking? A free, independent country with such a high treatment gap for mental psychiatric disorders. So 84.5% is the gap for mental morbidity. Common mental disorders 85, neurotic 84, depressive, and severe mental disorders 73%, which is bipolar and schizophrenia. For substance abuse, the treatment gap is 91.1%. Lots of alcoholics really don't come for treatment, even the tobacco users. And in the National Mental Health Survey, they also included epilepsy and intellectual disability, which is mental retardation. They found a high treatment gap. Now coming to the psychotic disorders, schizophrenia and other psychotic disorders. In this condition, I'm not going in details because it will be taken up by the other speaker. There are delusions, hallucinations, disorganized speech, catatonic behavior. Prevalence is 0.5. Males are greater in number than females. The urban metro cities are greater number. And the 40 to 49 young adults are the most affected. Bipolar disorder is a condition where there are moods ranging from depressive lows to manic highs. You can see in these pictures. The overall weighted percentage is 0.3, males more than females, and this, the middle young adults, greater in urban metros. In depressive disorders, there's a persistent depressed mood, loss of interest in activities, causing significant impairment in daily life, like you can see this gentleman here. 2.7% is the prevalence. Here, the females are more than the males, and the age group is the similar, more in urban metro residents and in this age group. Suicides. In 2018, 1,34,516 suicides were reported. 368 completed suicides per day. And if we take in the suicide attempts, 10 times more than this number. Isn't it shocking? The suicide risk was in this age group 40 to 49, 7.1. Again, here, females are more at risk for suicide. Urban metros more than the non-metros and the rural areas. High risk for suicide was heard in Kerala and in West Bengal. Probably the reporting is high there also. This study is from Nimmans with Dr. Suresh Badamat and his team, where they estimated the cost of implementation of various mental health programs, and they found lethal suicide attempts, so many 9,775 crores. Non-lethal attempts, this is the amount, 4 crores 77 0. Neurotic and stress-related disorders. You can see the eyes of this person, worried, anxious. So we have these are the various neurotic disorders. First is maybe panic attack, sudden uncontrolled fear or anxiety. Then we have agoraphobia, fear of situations where escape might be difficult or that help would be available if things go wrong, wouldn't be available. Social anxiety disorder, we are coming to know more about this disorder, an intense, persistent fear of being watched and judged by others. This fear leads to poor performance in work, school, and daily activities. So those patients who have to come to speak in public, to appear for the exam, to go for a job interview, they are literally petrified and they need real help because sometimes they are, living in misery. Then we have GAD or generalized anxiety disorder. Here there is excessive or unrealistic anxiety of certain aspects of life like work, social relationship, and accompanied with it, they have palpitations, sometimes shortness of breath, giddiness, and many times they are thought that these people are having a cardiac problem and they go for investigations which physically show nothing abnormal. It's all psychological. And then we have OCD or obsessive compulsive disorder. Here, the person has repeated intrusive thoughts, distressing thoughts called obsessions. And to neutralize these thoughts, they are told they do compulsion. So here you can see some of them, they like to, get relief by washing their hands because the obsession is of dirt. They feel the hands are with dirt, although they know it is not. And they go on washing their hands. And this is also one a very major disorder problem. Another is post-traumatic stress disorder, which is a delayed, protracted response to a catastrophic life situation like a natural disaster, earthquake, tsunami, or war, or rape, or a terrorist attack, people who are tortured, or serious accident, where they were threatened with death, sexual violence, or serious injury. The overall weighted prevalence was 6%. Females, again, more have neurotic disorders, and this age group, and it was greater in the urban metros. For agoraphobia without panic, 1.6. You can see by this arrow, this is the highest prevalence for this disorder, agoraphobia with panic, followed by generalized anxiety disorder, 0.6, social phobia, 0.5, OCD 0.3, and post-traumatic stress disorder 0.2. Then also the prevalence of mental retardation, which is intellectual disability. It is not regarded as a mental disorder, but many people come to mental health professions to seek help for this problem. And intellectual disability impairs adaptive function. It impairs conceptual, social, and practical domains. It begins in the developmental period of one's life, and the prevalence is 0.6. Among adolescents in 13 to 7 years, there is a prevalence of 1.7. Now, generalized tonic-clonic seizures or epilepsy was also part of the mental health survey. They found in 12 states that 0.3% was the prevalence. This age group, the younger age group, males and the urban metros were highest. Then we come to child and adolescent mental health problems. 7.3% among children in the age group 13 to 17. The prevalence among urban children 13.5, which is greater than rural children 6.9. If you see these figures, they're almost double. And again, from top, the most common is depressive disorder 2.6, then agoraphobia 2.3, intellectual disability 1.7, autism spectrum disorders 1.6, psychotic disorders and anxiety disorders 1.3. In one survey in 2012, so many Indians, 258,075 committed suicide. Among these, there was a large portion, 0. to 19 years, which also committed suicide. Unfortunately, statistics for this age group is not easily available. Then we also have now the geriatric mental health and the prevalence of problems which are mainly geriatric people or elderly or old people have sexual problems, they have geriatric depression, there are problems about dementia care. Then also many elderly people have comorbid medical illness. That means they may have cancer, they may have heart ailments, they may be having arthritic conditions. And all these sometimes, because they are so disabled by this condition, they may develop depressive disorders. Hence, the need to incorporate geriatric mental health in all primary health care centers. And the need to train primary care health workers in preventive work to reduce suicide in the elderly. Now, which are the populations at high risk for psychiatric disorders? We can see here mostly the female gender, child and adolescent population, students, geriatric population, people suffering from chronic medical conditions like HIV, AIDS. Then also India has seen a phenomenal number of disasters all around, even during this COVID pandemic. Disaster leads to emotional and physical responses to the majority of people after exposure to the disaster. Various international studies have reported 30 to 70% of mental health morbidity as an immediate aftermath of a disaster. So here you can see our Jai Jawans, helping during the disaster, which is very heart-moving. And then here you again see them in another operation where what type of mental health problems will be there in a disaster? Post-traumatic stress, major depressive disorder, generalized anxiety disorder, panic disorder. Another high-risk group for psychiatric disorder, disabled population, disaster survivors, populations in custodial care like prisons, remand homes. Then another high-risk group, marginalized, poor people, refugees, individuals with poor family, social and economic support. Here also we have, transgenders and people who are, having the minority sex groups. They also. Another high population is urban slum dwellers, uprooted communities, urbanized tribal communities. Now I'll turn a little bit to the substance abuse in India. This again is a landmark study conducted by All India Institute of Medical Science under the directions of the Ministry of Social Justice. 2 lakh and 111 households of 186 districts and a total of 4,73,569 individuals were assessed. Now, there are some terminologies they use. Current use of any substance abusing substance within 12 months is called current use. Harmful use, there is a questionnaire, WHO assist. If the score comes between 4 and 26, it's harmful use. It should be within the last 3 months. Dependence is when the scores on this WHO assist are greater than 26. For alcohol, it should be 11 to 26. And quantum of work, harmful use plus dependence plus the patient needs professional help. It is the most serious of the conditions requiring, and it qualifies for a substance use disorder. Now, if we see the prevalence of substance use disorders, the weighted percentage, we find tobacco is the main problem, but because it doesn't disturb people and they go on and develop chronicity, it's not so much attended to, but you can see 4.64. The other substance use disorders are less. Alcohol, the most common used drug or a drug of abuse. The 14.6 is the prevalence. So there are 16 crore users and 5.7 problem users and 2.9 dependent users. For every one woman who consumes alcohol, there are 17 alcoholic men, if you can see. Mostly the people are using deshi sharab, or what we call country liquor, and some, the more educated and upper rich class, consume foreign made liquor. So you can see a 14.6 more in males, also in females, and in children also in this age group it's there. Greater than 18 years, high prevalence. Then cannabis use in India, 2.8% is the prevalence, 33.1 crore users, 72 lakh problem users. And you can see there are two forms. One is the legal form or the bhang, where there are 2.2 crore users, and the illegal cannabis, 1.3 crore users. You can see here. And the prevalence of cannabis, more in males, also in children, but in this age group, very high. If you take cannabis, it's the most used, bhang next, ganja and charas less. Then we have opioid use in India, 2.1%, that is 2.3 crores opium users. The most common opioid use is heroin. Then comes pharmaceutical opioids. And then finally the crude opium. So 11 lakh, you can see a heroin maximum, and pharma opioids 25 lakh. So here is a patient who is smoking brown sugar, which is the most common one. They light a candle, they put the powder here, they use a pipette, and they inhale the preparation. More in males, also in females and children. Now, if we check the current opioid problem use in India, you'll see here, maximum is heroin, then comes pharmacological opioids like pethidine and all, and then comes the crude opium. There is a rising trend of opium in India. In 2004, In men, it was only 0.7%. Now it's jumped up to 3.97%. Inhalants, surprisingly, are a major problem in the children and adolescent age group. 1.17% children as compared to 0.58 adolescents. There are 77 lakh users. So here you can see it, more in females, but here very shockingly, more in children, you know. So if we see the pattern of use in adults, but there is a sizable number in the age group 10 to 17. These are usually poor children, usually in the slums. Sedatives are also being used in a big way. That is about 1.18 crore people. Cocaine 0.10%, amphetamine type 0.18, hallucinogens 0.12%. This is according as usual to the magnitude of the substance use in India. But if we consider all these things, still we can say that this is a small proportion of the Indian population, not compared to bhang and the other opioids and alcohol, which is the most. So cocaine use in India, 10 lakh cocaine users. Again, harmful and dependent pattern, again 3 lakh individuals. Maharashtra, Punjab, Rajasthan most affected. If you take stimulants, which is amphetamine, mostly they're using, prevalence is 0.18%, that is 19.4 lakh individuals. Harmful or dependent pattern, 0.6%, that is 7 lakh individuals. Maharashtra, Telangana, Uttar Pradesh, Punjab, Manipur, and Delhi are the places affected. Hallucinogens are drugs which produce hallucinations. And you can see here, there are 12 lakh individuals. Although compared to the other drugs, much less. Harmful dependent pattern, about 3.4 lakhs. Again, Maharashtra, Telangana, Kerala, and Delhi are badly affected. Now, what is very disturbing also is the drugs which are being injected or injection drug use. Current injection drug use is the use of any intoxicating substance through injection route, even once within the past 3 months. These are patients are at a high risk for HIV and hepatitis C and B. People who inject drugs, they're called PWIDs, are about 8.5 lakh in India. In all states in India, but less or not present in the Union Territories, Andaman, Nicobar, and Lakshadweep. So if you see the injection users, heroin, buprenorphine, pentazocine, and other sedatives. Injection use, opium or pharmacologic opioids is also there, 46%. Ketamine, very few people inject them. Usually these injection users are injecting daily about 49%, and about 18% inject themselves 4 to 6 times per week. They develop vein complications, ulcers, or abscesses at the injection site. So here you can see, compared to the world and compared to Asia, India has quite a large number of opioid addicts. Even other cannabis use is high. So treatment for alcohol, 75 do not receive treatment, whereas only 25%. Some require hospitalization and others other treatment. For drug dependence, only 25 receive treatment actually. Hospitalization and other treatments are about this way. Now, as Dr. Bahaley was also mentioning that post-COVID-19, they are anticipating or predicting a surge of mental disorders. All of us during the lockdown and the early days of the pandemic were really terrified. Such an experience never had before by anyone. Now, there is a historical demographer, Steven Eric Malemun, who has studied hospital admissions in asylums in Norway and during this people. And he found that the number of first-time hospitalized patients with mental disorders due to the influenza pandemic increased by an average annual factor of 7.2% in the 6 years. So if this could have happened in a influenza pandemic, they are expecting the numbers also to rise after this COVID pandemic. Now, coming to mental health manpower, so we have psychiatrists, psychologists, psychotherapists, psychiatric nurse. These are all part of our team. A psychiatrist is a medical graduate with a postgraduate degree, MD or DPM in psychiatry. A psychologist, a non-medical graduate with a degree in psychology. A nurse, psychiatric nurse, special training in psychiatric nursing. Psychiatric social worker, a non-medical graduate with an MSW in psychiatric social work. Now, according to the Mann study, 130 crore population, so many with diagnosable illness, number of psychiatrists 9,000, psychiatric nurses 2,000, psychiatric social workers 1,000, clinical psychologists only 1,000. So you can see they have calculated a big deficit for psychiatrists 30,000, for psychiatric nurses 37, social workers 38, clinical psychologists 38,000. They estimated that only for psychiatrists you'll have to arrange for 30,000 crores. So you can imagine what will be the cost. Phenomenal. So coming now last to my take-home message. For all you young people, general practitioners, and all desirous mental health professionals which be working for patients with mental psychiatric disorders. So the take-home message from the mental health survey is severe mental disorders are very important. Mental disorders contribute for significant morbidity both in urban and rural. Common mental disorders, mainly the neurotic disorders, have a high, huge, unrecognized burden. As I told you, they are invisible. The economic burden of mental disorders is enormous. Treatment gap for mental disorders still remains very high. Lots of mental psychiatric disorder patients still untreated. High suicidal risk, increasing concern in India. The productive age group, 30 to 49 years, which is the time when people work and earn, this is the most badly affected. Both genders are affected. Children, adolescent, and elderly are vulnerable. Epilepsy and intellectual disability are also major problems. 3 out of 4 persons have a mental disorder. Mental and substance use disorder significantly affect quality of life. The magnitude of substance use disorder, we need scientific evidence-based treatment for substance use disorders in an adequate scale. We need evidence-based substance use prevention programs to protect young people from falling prey into a drug problem. We need a conducive, good legal and policy environment to control drug problems. We need to approach and generate scientific evidence. So with this, I thank you very much for listening, and I thank the organizers, PPA and IPS Pune Branch for calling me and allowing me to grace this occasion by giving my talk on psychiatric disorders. Thank you. Bhalchandra, I cannot hear you. Bhalchandra, we cannot hear.
Sir, please unmute yourself. Bhalchandra sir.
Yeah. Yes. Thank you, sir, for your lucid presentation. Sir has described the classification of psychiatric disorder in a very simplified manner. Plus, he has also described the present condition of psychiatric illness and present condition of our mental health manpower in the country. Sir, there are some questions. The questions for both sessions we are taking, there are questions. First question is that should we do the psychiatric evaluation of person every year, like we do the dental examination every year? So this
This
question is for you, sir. Hello.
Actually, it will depend, to refer a person to a psychiatrist uh, will require some strong reason for the same. So if there is a problem, if the person feels a need to go for he's not, say he's having his biofunctions are disturbed, sleep, appetite, he's feeling low, then probably he should voluntarily come forth to meet for help. But in some way, I don't think we can routinely send everyone for a mental health checkup as the position stands now.
Sir, once again you are mute. Bhalchandra sir, we cannot hear you. Yeah.
Now?
Yes, sir.
Yeah. There is another question that about transference and counter transference. Dr. Prasad Lad is asking that whether the psychology of psychiatrists get affected by seeing this psychiatric patient regularly.
No, whether I didn't
Whether
get
the
it.
psychology of psychiatrists gets affected.
See, Dr. Bahaley, you are going to answer or you want me to answer?
Sir, please go ahead.
Yeah. Actually, transference and counter transference is a phenomena that is seen by every person. But probably because we psychiatrists and mental health profession, like psychologists, are trained and we know about Freud's theory of personality and all psychoanalysis. So it is like this, that any patient who likes you and becomes overtly attached to you, you could say develops a positive transference. And any patient who hates you, fights with you, that could be called like a negative transference or counter transference. So I would say that these are phenomenon present in any doctor-patient relationship and also in a maybe more intensely in a therapist relationship where they see the patients for many settings, for many hours, for many days, together, like maybe once a week for maybe many months. So the relationship can become very charged. So according to me, there are various methods which may not be in this forum to discuss, but how to become aware of transference and counter transference in our doctor-patient relationship or in our professional relationships, and how to manage them properly so that it doesn't cause any trauma to any party.
Bhalchandra sir, the next questions,
Hello.
please.
Yeah. But this question is for Bahaley madam. What is the importance of mental health in community?
As we have stated in our talk, now mental health is becoming a community health problem, because as we have seen from the surveys that have been done by NIMHANS, almost 10% of our population is suffering from some or the other mental health disorder. So 10% is a very, very large population. So it definitely, this is turning into a community health problem. And the government has actually taken positive steps. We have set up district mental health teams in every district, and we are reaching out to people. We are creating awareness. And because disorders, mental health disorders like anxiety and depression are very common, and definitely we have to reach more people for that.
Okay. Next question is also for Bahaley madam. Um Dr. Pradnya is asking which age group is most affected in any pandemic situation, and how it affects next generation.
Okay. If
Which age group is most affected?
I don't think there is any study that a particular age group is affected. I think Dr. Netto sir can perhaps add to this. But as a pandemic, it will have an intense and uh, wide psychological effect on every person. Uh, Persons who are vulnerable for psychiatric ailments, basically, as we see that anxiety and depression are more in women, the same vulnerability can be observed in a situation of pandemic like this. So, as of now, officially, we do not know whether a particular age group or particular group of the society is more vulnerable. Dr. Netto, sir, can you please add to this?
Yes, yes. Thank you, Dr. Bahaley. I think it's a very important question. And what Dr. Bahaley is saying, I also endorse that the pandemic has just occurred and the research in this field is not that much advanced. But what we are predicting is definitely the healthcare workers are going to be affected because they were in very trying situations. You know, they were at risk, especially in the beginning part of the pandemic, where there were PPE was, poor quality. They had to risk their lives and all that. Many have been working hours on end, exhausted, run away from their families. So this will be a large number of people, the healthcare workers who are doctors, nurses, you know, and they will be the ward boys and people working in hospitals, would be very badly affected. The second would be uh, the patients. If you see the COVID pandemic, we had those with mild illness, moderate, and severe ICU patients. Now, the mild patients, many of them have recovered, but we have moderately ill patients and severely ill who are in ICUs. Many of them are still incapacitated. We see patients who need on a daily basis oxygen. I know of people who tell me that, when my brother comes to ring me on the phone and talking to me is breathless, I feel so terrible listening to him only. So these will be definitely the people who need mental health support to a great extent. And also all these caregivers and people who have been affected in a big way by the pandemic, those who lost their jobs. There has been a rise in domestic violence, and even child sexual abuse because the child was locked with the predator at home. The amount of helpline calls have increased. So I think there is going to be, and we are already seeing it, a hospital, Sassoon Hospital and Maharashtra Institute of Mental Health, we already have an online. Now also there are people coming with various types of fears related to the injection, the vaccine. Although the vaccine is available, they are petrified. They are really frightened that if I take it, will I die? And there are all contradictory reports from foreign literature. And also, I think these people will surely need a lot of psychological support.
Okay. Next question is from Josna.
Sir, you are mute again.
Is there more psychiatric illnesses in urban population than rural population? And if it is so, what is the reason?
That's for me. Yeah. So the National Mental Health Survey, which was conducted by Nimmans, they have the states that were taken for this survey were divided into clusters. And probably they have not given in the survey the reasons for this. They have not given the reasons, but if we sort of speculate, the reasons could be many. One is in the urban life, there is a stress. The people are living in a congested environment. There are so many, especially in slum areas, there are a lot of like these drug abuse problems. And, there's a lot of peddling of drugs and all in this slum areas, overpopulated cities. And in some way, the sophistication of life in an urban metro city is much more than a simple village. So, in the village, there is a family tie, they have a bonding to the village and all this. Whereas here, in the city, they live alone. Sometimes the husband is working in the city, earning money. The children and wife are at home. He's lonely. So therefore, lots of like these socio-cultural issues lead to greater mental health problems in the urban metros than in the rural areas.
There's a problem is with the- Bhalchandra?
Hello.
Huh.
His audio video has stopped. Sir's audio video has stopped.
No, he has finished his say. You can ask the next question.
Okay. So next questions are on schizophrenia and substance abuse disorder. I think they will be better answered in that particular sessions.
Yes.
Now we will move to the next session. Next, that we have some announcement to do. Next month on the fourth Friday, we have session on schizophrenia and psychosis by Dr. Madhumita Bahaley and Krishna Kadam. So I request all the audience to participate in that session also in a large presence. Now I request Dr. Yogesh Pokre to give the vote of thanks. Yogesh?
Can you hear me?
Yogesh?
Hello? Yeah. Indeed, sir, it was,
Yogesh.
am I audible, sir?
Yes, sir.
Yeah.
Yes.
Yeah. Indeed, it was a fabulous session. What a great start of the year 2021 with wonderful academic sessions of Sathi Badhana, a monthly series by IPS and PPA. I would like to thank Dr. Madhumita Bahaley, madam. She has opened the series in a fantabulous way. Many thanks to her for accepting the request to deliver the first session of the series. I will also thank Dr. Ivan Netto, sir, for explaining psychiatric disorders overview in the most simplified way. I will also thank Dr. Bhalchandra Kalmegh, sir, for moderating the session. I also thank all the senior psychiatrists, doctors, colleagues, friends, along with all the psychologists and social workers and everyone for attending this session and making it a huge success. I would also like to thank Mr. Anurag Srivastava, Mr. Aryan Mitra, Mr. Mahesh Apar, Shruti and Rahila, and the entire team of Center for being the academic partner and for arranging things in a perfect fashion. They have really worked hard to make this session a real success. Thank you once again.
Thank you.
Thank you.
Yeah. Now I ask Anurag Srivastava sir to give the final words.
Thank you, sir.
Anurag sir.
Yeah, sir. Sir, I'm audible?
Yes.
Yes.
Yeah. Sir, I feel honored. And again, I think this is from IPS and Pune Branch. This is the second program, though it's a first program of this particular extravaganza which we have initiated. And nothing better than the name called Sathi Badhana. I think, sir, we all are looking as an individual. I'm not talking from the company perspective, but as an individual human being, a person. We are looking to अपना हाथ बढ़ाना चाहते हैं towards the fraternity, the psychiatrists, the psychologists, because we all need your help. So thank you very much for being there. And need as a human being, we all have gone through lot of issues. Now these issues are going towards a decline. But now the second pandemic, which everybody is talking about in very general. Just now I was traveling in a flight. I was coming back from Hyderabad and I was interacting few people who were sitting just next to me, and they all were saying that mental illness is going to be the next pandemic. So we all need your Sathi for all of us, and we all need to raise our hand towards you. That is what I believe. And what better than starting this particular extravaganza with name called Sathi Badhana. So I thank Dr. Bahaley madam once again for being setting the tone for the year 2021. And Dr. Ivan sir, thank you very much, sir, for enlightening all of us. Again, I represent Center of Pharmaceutical, but I also represent a lot of Indians who need help, to say. So I thank Sir Dr. Bhalchandran sir and Dr. Yogesh sir for moderating this session. And this is just a beginning. And we all this has set the tone now. Now this tone is set for the whole year. We have now the entire capsule. Ivan sir has presented the psychiatry illness. Now we will take one by one, and we all will go through and complete the year with a lot of learnings. So on behalf of Centaur, I would like to thank all the medical fraternity who have spent their Friday evening once again with all of us. And from the team Centaur, I would like to put forward that we will be meeting all of you time to time and thanking you for helping us. Please continue to help us, support us. Your support makes us more strong. So once again, thank you for all of us, and good night, sir.
Good night.
Yeah, thank you. Yeah, thank you and good night.
Good
Thank
night.
you, sir.
Good night.
Yeah, good night.